Hello and welcome to today's webinar, Combination Therapy, Z-Wave and Aesthetic Devices. This webinar is presented by Zimmer Aesthetic Division. I'm Regina West and I'll be moderating the webinar today. During the presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. If there's time following today's presentation, we may be able to cover those questions during the webcast. If there's not enough time remaining to get to your question, an answer will be emailed to you. I'd now like to introduce the speaker for today's webinar, Dr. Rakesh Nanda. Dr. Nanda is the Medical Director for Grandview Aesthetic Center and Jiva Med Spa and Plastic Surgery, both located in Ohio. He has advanced training in dermatology, aesthetic, cosmetic, and dermatological laser procedures with specialized training and full certification and credentials in a broad spectrum of advanced laser treatments, dermatological procedures, liposuction and body contouring, hair transplantation, broadband light, facial contouring and tightening, facial reconstruction, tattoo removal, hormone replacement therapy, and PRP treatments. He's taught thousands of physicians and holds speaking positions and trains around the globe on the topics of laser and cosmetic procedures for all skin types. Welcome again, everyone. And without further ado, I present Dr. Rakesh Nanda. Dr. Nanda, thank you very much for being with us today.
Thank you for having me.
And I'll now give you control of the presentation, Combination Therapy, Z-Wave, and Aesthetic Devices. Give me just one moment and we should be able to see your screen. Okay, Dr. Nanda, I see your presentation.
Very good. All right, so I'm very, very excited today to present this topic, Z-Wave applications. And so I'm going to kind of show you guys how I use the Z-Wave, how I maximize this to really increase patient comfort, reliability, get, increased revenue and ROI. So I'm super excited to have this, and I'm thrilled that Z-Wave had me on to speak about this. So without further ado, I'm going to go ahead and jump right in here. There's questions at the end, so feel free to post any questions you have, and I'll be happy to answer them as long as it takes. So let's start out here. So the first slide here is talking about the applications of extracorporeal shockwave therapy, so ESWT. So this is kind of a jumble of words, but this is basically the nitty-gritty of what Z-Wave is. So it's the application of mechanically generated sound waves. It can't be confused with ultrasound. So a lot of people think Z-Wave is just like ultrasound. It's not. It's radial pulse therapy. So basically, we're trying to, in a nutshell, increase lymphatic drainage and metabolic metabolism. So that really amounts to a reduction of cellulite. It also helps with muscular pain. Physical therapists like this a lot after injuries, especially with trauma and surgery. That's where this first kind of came out. Now this is FDA approved for the treatment of cellulite. Very, very often used following devices such as CoolSulpting, Vanquish, Sculpture, UltraShape, truSculpt. We use it a lot for lymphedema, scarring, adhesions, and a bunch of other cosmetic procedures, including mirror dry, tattoo removal, erectile dysfunction. Those things are not endorsed by Zimmer, but I want to actually talk to you about that because I want to give you guys a lot of good off-label uses too, so you can really maximize the use of your device. So we're going to talk about what the FDA clearance for Z-Wave is. So FDA clearance for Z-Wave is temporary reduction of cellulite, the increase in local blood circulation, and the relief of minor muscle aches and pains. Those are the three things that Z-Wave is FDA cleared for, but I'm going to go into a lot of other things in addition to these. But I wanted you guys to know what is labeled for Z-Wave. So here we have some pictures of the actual device. You can see our Z-Wave devices, pretty sexy, nice devices. So we have two little hand pieces here, and those are attached to our screen, and we can input the different settings. I'm going to give you guys a little pearl here now. We have a brand new Z-Wave. This just got unloaded. I think some people that were at some of the conferences recently got to kind of view this new, really slick looking device. So what's the difference between the new Z-Wave and the old Z-Wave? So Zimmer's kind of given me the permission to be able to talk about this. So this new Z-Wave device is water cooled, so it allows for one handpiece. So that's super cool. So as opposed to the older Z-Wave devices, which I have, by the way. This new one has one handpiece, and I can't wait to get my hands on this thing because it won't overheat with longer treatments such as cellulite and ED. When we're treating cellulite and erectile dysfunction, we will use a lot more pulses than if you're just doing a normal, post CoolSulpting or truSculpt treatment. So this thing is not going to overheat because of that water cooled device. Number three, it's really quiet compared to the current device. So our current Z-Wave, you can hear it, it's Real Pulse technology. So you can hear it kind of pounding away. It's doing its thing. This new one is a lot quieter. So it's actually super slick, really neat. I wanted to kind of show you guys that as a little treat to kind of show you what's up and coming here. So let's talk about Z-Wave technology now. So let's really get into it. So how does Z-Wave work? The pressure waves are transmitted through the surface of the skin, and they go down into the tissue, affecting a large and deep treatment area. That is the key. We want to go deep. We want to go down as far as we can into the tissue, as opposed to physical therapy uses where we would want to kind of stay more superficial. When we're treating cellulite, when we're treating fat, when we're treating ED and all these other things that I love to use it for, we really want to get down and deep, and this technology affords us to do it. So you can kind of see a nice illustration here. So that's what we're talking about in this next slide where it says size matters. So the speed of the treatment, awesome. 39 millimeter, really fast, 4 times faster than our competitors here. And the depth of penetration with that larger spot size really delivers our energy into things deeper like our fat. That larger spot size helps us reduce dermal complications like bruising. So we know smaller spot sizes focus that energy a little shallow, but when we're doing aesthetics, we want to go deeper. So let's talk about how we use this for cellulite. So short-term increases of blood flow are caused by vasodilation and massage. We want to try to do new blood cell formation. All of you guys know that's called angiogenesis. Our lymphatic drainage leads to washout of our toxins and our triglycerides. That mechanical and biochemical lipolysis is what we're trying to lead to with that relaxation of our septum. So this will strengthen our connective tissue. What does that do in the end? It leads to overall elasticity and firmness, and that's what everybody desires. That all is explained in this beautiful slide, and I love this because this really gets down to it. So why does cellulite form? It's springtime. Everybody wants to get to the pool. We don't like cellulite. That's not our friend. So cellulite forms from enlarged fat cells, poor circulation, a lot of water retention, and then fibrosis for connective tissue with that toxin accumulation. That's how cellulite really forms. Those are 5 reasons for forming cellulite. So in this slide, you can see our big fat lobules on the right-hand side. That's unhealthy tissue. And you can see our epidermis at the outside, dermis a little bit further in. And then we have these big fat lobules and these fat cells. We don't like that. We want to get them smaller. So you want to look at that slide over next to it where is the healthy tissue. And what Z-Wave does is it penetrates deep. It hits that cellulite. It increases that lymphatic blood flow, metabolic metabolism, leading to a smaller evacuation of these fat cells, which is what we get with that healthier tissue. So let's go into some studies here. So I like this study. This was by Dr. Pablo Garcia. And so he was out in Spain. And what we did was he actually looked at this and he actually showed, if you see that top picture, that top picture is the image of cellulite with poor blood circulation. Now that bottom photo, that's what we want. We want this after 10 treatments of Z-Wave. You can see the difference. We have really, really nice blood circulation over our treatment area. And that's really, really what we're trying to get to here. This is another picture here. So if you look at this slide, you can actually see the top, that photo on the side there. That's an ultrasound image of the right thigh right before the first Z-Wave treatment. That corresponds to cellulite of degree 3, which shows enlarged fat cells. That's kind of going back to that prior slide. We have intracellular fluid and a regular skin surface in there. So in the next photo, we can see after 10 Z-Wave treatments, it's much, much better. You have a good, smoother surface. So this is real-time results. We all in medicine like evidence-based studies. I love this study because it actually showed that exactly. So now let's jump into some uses that we can use for our Z-Wave. So Z-Wave use is with invasive as well as non-invasive procedures. Let's talk about the non-invasive procedures. CoolSulpting, which we all know that's using cold to destroy the fat. truSculpt is similar, but it uses heat. And what truSculpt does is it'll melt away the fat, and it'll also cause a little skin tightening. We have Sculpture and Vanquish, some radio frequency devices there with Vanquish. We have Ultra Shake, Thermi, soft tissue injury. Love it with soft tissue injury. We're going to get into that later. I like to use this after Kybella. It's really, really good. About a day after you get Kybella, you bring them in, you do the Z-Wave, you're going to have an amazing response. They're going to just think you're just amazing. They're going to think your injectors are great. I do a lot of tattoo removal. We'll do upwards of 200 tattoo removal treatments a week. We do a lot of tattoo removal. I like to pull in my Z-Wave. I hit it with the Z-Wave right before. It breaks up that ink a little bit, and then we can actually do a little bit after. Now, I want to tell you guys, post-tattoo removal, this is not FDA cleared. This is off-label, but I want to present this to you guys, so I just included that on my list. Let's look at some other non-invasive lipolysis devices. These can all benefit from Z-Wave therapy because it reduces pain post-procedure. You have a much, much faster and easier recovery of the patient, more consistent outcome, marketing advantages. I'm going to talk about that in just a moment. Kybella, we talked about this a second ago here. So you have to wait at least 24 hours after your injections of Kybella, but it really helps with that soft tissue injury. I see recovery is actually a little bit more than 50%, but 50% is being, conservative, and that gives you a great marketing advantage over your competitors that don't have that. It's a good way to sell this product, Kybella, and really tell them, look, I'm going to give you this added bonus of the Z-Wave. It costs you nothing, but it's going to give you a one-up over your competitors. So I want to mention that. So those of you guys that are doing Kybella that have a Z-Wave, start using it for it. Post-tattoo removal. We talked about this a second ago. It relieves pain and swelling after the treatment. It speeds up our healing. I see a reduction in the number of treatments with this because it really breaks up that ink. It gives me an advantage over my other competitors. So first of all, I have both the Cynosure, PicoSure, and I have a Cutera Enlighten. So I got Pico devices at my disposal. Those are awesome. Those are the best devices out there that I know of for tattoo removal. This just makes it even better. So I can give even better results than my competitors that have those devices. Again, that is off-label. Let's talk about sports and traumatic soft tissue injury. Plantar fasciitis, amazing. A lot of people have plantar fasciitis. It's springtime. We're going into summer. People play tennis. They run. There's marathons going on. You can bring them in, do some treatments for plantar fasciitis. You can increase a large amount of revenue into your bottom line, about $1,000 for a package. You can do it for $179 a treatment. It takes about 8 minutes. You want to do this treatment. You bring them back in about 3 days. You do it again. Sell packages of 3 to 6, and this will really, really kick it through. You can use your 39 millimeter handpiece, or you can use a 25 millimeter handpiece for this. But again, this is an off-label use, but I wanted to mention it to you guys because that's really, really good for it. So while that may not be intended application, we're using this to increase revenue. This is something you can just add in as a bonus for your patients. They're going to think you're awesome. So let's talk about liposuction and other types of cosmetic surgeries. So this will actually really reduce the pain of our patients post-lipo. So you're doing liposuction. They have this lymphatic drainage. They have this swelling. Hit it with a little bit of Z-Wave at a lower setting. It really reduces that pain. It gives them a much quicker recovery time. And again, marketing advantage. That's why we're all here. Now, a new emerging application, I have to mention to you guys, this is completely not FDA cleared. This is totally off-label. So Zimmer does not endorse this. I am telling you guys this as a physician. I'm allowed to tell you what I use it for. So I use it for ED. A lot of other docs that are in the know will use this for ED, and it really, really helps for erectile dysfunction. Huge problem with men. Peyronie's disease, huge, huge problem. You can make thousands of dollars with this device and really, really increase that blood flow to the penis, help with the curvature, and it's a home run. So I'll entertain any questions you guys have off-label about that, but I wanted to mention that to you. Think about how much money you can save from pharmaceuticals by helping patients with this. So I included a slide here of our Cynosure PicoSure, just because I wanted to show you guys about the tattoo removal, and here's my Cutera Enlighten. Let's talk about CoolSulpting. This is awesome. So a lot of us out there have CoolSulpting. When you do CoolSulpting, there's that manual massage at the end. This is very, very often something that will shy patients away from even doing CoolSulpting because they don't like that massage. If you go and you read about CoolSulpting, one of the biggest things that people don't like about it, or that makes them not even want to do it, is that nasty massage at the end. And I know that that increases the therapeutic advantage of CoolSulpting. And I'm not saying not to do the massage, but how about if I could say you could do that manual massage for about a minute instead of 3 minutes? And then you can add on 3 to 5 minutes of Z-Wave. And you do that 3 or 4 times, and guess what? You're going to add an extra 8 to 10%, maybe 12% of fat destruction. This is why it's awesome, because I can do this on patients post-CoolSulpting post my truSculpt, which I have both of those devices. And now a lot of times they don't have to come back for a second round. I'm not saying they don't, but I'm saying that you're going to give them such a good advantage that if you can save them some of that money from coming back and doing another round, they're going to think you're amazing. They're going to think you're awesome. And you got to one up against everybody else. If you live in a town like I live in Columbus, where there's 30 something plus CoolSulpting people here, what's your advantage? My advantage is I have a Z-Wave and no one else has this thing around here. And I can give them a much better treatment, more comfortable, and give them better results. That's what's awesome about this device. So I wanted to include that in here and talk to you guys about that. Here's some pictures of our personal patient. This is a lateral view of his tummy before and after. This is one round, by the way, guys, of CoolSulpting, and you can see the difference there with Z-Wave. Here's another anterior and kind of a lateral view of a tummy. This is after one round of Z-Wave, one round of CoolSulpting with the Z-Wave added in, guys. This is a kind of a pic collage I put together. So look at that top picture. You can see his anterior, lateral, and posterior view. 1 month later, 6 weeks later. This guy is actually, he was in Columbus, which is where I live, where we're doing this at, and he moved to San Francisco. This guy was so happy with his results from CoolSulpting with Z-Wave that he is flying back to do a second round because he wants even more fat gone. And guess what? In San Francisco, there's a lot of providers with CoolSulpting. Not that many with Z-Wave. He trusts us so much because I gave him such a good result with CoolSulpting and Z-Wave that he's flying all the way back here to do it with us again. And he has sent me probably a dozen different patients. My advantage was the Z-Wave, guys. So I want you to really start using that Z-Wave with your CoolSulpting if you can. Look at that difference on cellulite and body tightening right here, even a lift of the buttocks. So this is another one of our patients I wanted to include. Tattoo removal, one of my favorite things. So this is a before and after. What I did was I ran that Z-Wave over that tattoo. We hit it with the Pico, and then we kept doing it. And look at that difference right there. Amazing, gone completely. Another example here. Yet another one. Now let's talk about some cellulite. Cellulite is one of the biggest uses of Z-Wave. This is a FDA cleared temporary reduction of cellulite, so it's one of the FDA cleared uses of Z-Wave. Look at that difference there in that cellulite and the dimples. Nothing can do this that's non-invasive. I haven't seen anything else get to this kind of result with no pain, no downtime. They can do this, go right back to work. So if you haven't started using your Z-Wave for cellulite, you need to start using it. This is after 3 sessions. Actually, not only did it reduce the cellulite, also got a really nice lift of the buttocks here. Same thing here. Look at that difference there in the banana roll. Looks way better. Before and after Z-Wave. Again, nice contouring, lifting of the buttocks. Yet another one. This is a great picture here because that cellulite just totally got reduced with this. Yet another picture. This was one of my favorite ones because this was a home run. Look at that difference there on the side with the cellulite. Really, really good reduction there. Right there, that's after 3 Z-Wave sessions. And this is our personal patient. So you can see before and after CoolSulpting Z-Wave. So here's another study I want to tell you guys about. So this study was done where they showed that the Z-Wave can really activate our metabolic activity, stimulate blood circulation, production of collagen. This is what really, really made us start knowing that this thing really works. And look at that before and after right there. There's over 10 published studies on this, and there's more counting. So in one study that I wanted to look at, Hunt, he did this with CoolSulpting. We had a 22% fat reduction with the Z-Wave after CoolSulpting at 2 months. Okay, that's great. 12% fat reduction with hand massage. So would you rather have a 12% reduction with a hand massage, have that pain? Would you rather have a 22% reduction? I think all of us would take that 22 and less pain, less discomfort, less downtime. So you want to try to get about 4 weekly treatments. That will give you 80% of that final result. And it's going to be a much quicker result, which is what everybody wants right now. So this is kind of our squeeze test here. Look at that difference between hand massage and Z-Wave. You can see a big, big difference there between the two. Here's another one. You can see on one side Z-Wave, one side hand massage. That's very easy to see the difference. So we can use this with Vanquish. Those of you guys that have radio frequency devices, whether you have Venus Legacy, Venus Freeze, a Vanquish, this helps with all of that. We have Venus Legacy and Venus Freeze. We love that. We'll add some Z-Wave on that. It's just the home run. So you can include this with any of your radio frequency devices as well. So this is kind of showing us our treatment effect. So we're going to have that vasodilation massage. You're going to have that long-term effect of the blood vessels, toxins, triglycerides. That's why I wanted to throw this slide in again. So that concludes our first part of this, and I'd like to entertain any questions that you guys have.
Okay, thank you very much for your presentation, Dr. Nanda. Your images and your information.
You're very, very welcome.
Your images and your information were very remarkable and compelling. Okay, we have some questions rolling in here. The first one is, what are your success rates for Z-Wave after body contouring, and can you really see a difference after using Z-Wave versus without Z-Wave?
Yeah, so I really can. I mean, so I'm going to be honest. I actually got the Z-Wave first because of body contour. So when I first purchased the Z-Wave, I didn't know about any of these off-label things. I mean, a lot of these things I'm just kind of figuring it out on my own. And, you know, we really started getting into it first for body contouring. And the biggest thing was CoolSulpting because people really dislike that manual massage. I can tell you with 100% certainty, and I showed you pictures because, you know, we can all talk, but we're evidence-based. I have really done my own studies. I'm not relying on anybody else's. I've seen a huge reduction. And actually, people come in just for that because they know we have the Z-Wave.
Okay, another question here regarding tattoo removal this time. You mentioned in your presentation that you use Z-Wave with tattoo removal for numbing and for better results. I believe you mentioned that briefly.
Yep.
Can you expand on the difference in the discomfort level and how the results are affected by using Z-Wave?
Okay, so tattoo removal can be a pretty painful thing. You have Q switches, you have picos. Q switches we know builds up thermal heat. Pico is drilling. You know, it's a trillionth of a second of pressure that breaks that ink apart. So what we're trying to do when we're using a pico, for example, is we're trying to use our pico technology, which is a trillionth of a second of pressure. It actually doesn't even touch the skin. It's that pressure that shatters that ink like glass. Now that can be a kind of a painful process. So what we like to do is we like to run our Z-Wave over the skin first. That radial pulse technology is almost like a numbing effect. A lot of you guys will use vibrators, massagers before oral therapy, before giving injections. Why are you doing that? You're doing it because you're doing a similar thing to the Z-Wave. You're causing that radial pulse technology. This is going to desensitize the pain. Then I rush them in there and I throw my Zimmer chiller on it. Again, another Zimmer product, the Zimmer chiller. It makes that area really nice and cold. I've already numbed them up with the Z-Wave. Then I hit them with it. It makes a world of a difference. So that's how I use it.
Okay, next question is, how is the Z-Wave similar or different from the Soliton rapid acoustic pulse technology?
Okay, so that's a good question. So that's one of the competitors. So the Z-Wave can hit with heavier pulses. It can go a little bit deeper. It has a larger pulse size. So I can get my end result quicker, faster, and I can penetrate a little bit more energy in. So that's how it's a little bit different.
Okay. Another question coming in here. In use with truSculpt 3D, can you speak to how that gives you better outcomes?
Yep. So truSculpt 3D and truSculpt ID, whichever one you have, it's exactly the same process as CoolSulpting. So what I do is after I do my truSculpt 3D, we have both. We have the 3D and we have the ID. So what we do is we'll actually do that truSculpt first. So truSculpt is heating up the fat as opposed to freezing it. And then we're going to have some skin tightening with it. I throw on my Z-Wave right after it. So immediately when I'm done, and then I bring them back, 2 to 3 times in the week, and then I bring them back every 2 weeks. And that gives me very similar results to the CoolSulpting in terms of that extra 8 to 12% fat destruction. So you want to treat it just like you're doing CoolSulpting.
Very good. Here's another question about ROI. Do you add it in to your current treatments at no charge instead of a discount, or do you charge for treatments outside of Cellulite?
So that's an awesome question. I'm glad someone asked that. So here's how I do it. If I'm doing, for example, I have Cellfina also, and I forgot to mention that, guys, that I have a Cellfina. I will always add in 3 extra Z-Wave treatments with my Cellfina. And I bundle that in. It's added value. Why? Because it takes me 10 minutes. It costs me 0. And it's going to give me an added advantage to my competitors because you're giving them added value. I tell them otherwise it's $300 a session. So if they want more after that, they're going to pay $300 a session. But it's almost like, these first 3 are on me and you pay for the rest. So they're going to get so hooked onto it that they're going to love it, and they're going to come in and they're going to want this all the time. Now remember, cellulite, radial frequency, all that stuff is temporary, right? you got a lifelong patient here. Cellulite's not going anywhere. We all go, we all age with time. It's the one thing that goes up and never goes down, right? Is age. You got a customer for life with that Z-Wave. Build it into a package. Sell them a package. Sell them a package of every quarter come in and do a certain number of treatments of Z-Wave and build it in as an annual contract. You can make a lot of money like that. And that's why the IRI goes so high with the Z-Wave.
Okay, another question. If you've had patients who first experienced CoolSculpting with hand massage, then later CoolSculpting with Z-Wave, did they report anything different?
Yes. So the hand massage hurts. Makes you have to go to the bathroom. It makes you scream. You see the stick of butter or fat. The different thing that they report is there's not that pain. They have a lot less neuropathy. So one of the other things that we always get scared of with CoolSculpting is neuropathy. I don't know if any of you guys have had that. We have. We've had to put people on Lyrica. We've had to put people on Neurontin for this. The Z-Wave will actually help eliminate that. And guess what? That tingling and numbness that happens after CoolSculpting that's common, and people are like, oh, I like this tingling and numbness because it means it's working. That's awesome. But you don't have to live in pain. Bring them in and do another one or two Z-Waves. I guarantee that neuropathy is going to go down or go away completely. So you can actually eliminate having to give them medications if you use that Z-Wave, and just give that to them. Bring them in. They're going to think you're awesome. Just give it to them. And that makes a whole world of a difference.
Okay, as soon as you mentioned Cellfina, we had a question come in about Cellfina. Has your use of Z-Wave with Cellfina helped to increase the interest in that treatment?
Yeah, so Cellfina is a tough cookie, right? I mean, it's a tough one, and I work a lot with MERS. We try to help with some protocols. I think there's some MERS people on the call today too, listening to this. So I do a lot of Cellfina treatments, but we like to use our Z-Wave with it because you can't always get those little dimples with Cellfina. You can get those deep dimples on the buttocks, the thighs, the anterior and lateral thighs. Yeah, that's great. But how about those little rolling cellulite that's really not a Cellfina candidate? You add a little Z-Wave on that, you're going to actually really increase that light cellulite. They're going to think you're amazing. It makes you look good. It makes them refer to you. They're going to post all kinds of real stuff and Google reviews about you, and you're going to be like, you're going to get a home run out of this. That's why I love it with Cellfina.
Okay, there's another question coming in here about cost of Z-Wave, and are there any disposable or ongoing costs?
Yeah, so there is a slight disposable Z-Wave. It's not it's the handpiece really that you replace, and then a couple of the other pieces that go onto the handpiece. That's it, but it's negligible, guys. I mean, you're talking about $2-3 at most, so it's nothing big. Talk to your rep; they'll get you set up with all of this stuff. They'll give you they'll break it down to a per patient cost. It's negligible. I don't even count it in because it is completely negligible. So in terms of consumable costs, I look at it as a zero. Really, it's nothing.
Okay, another question here going back to CoolSculpting. What is the protocol after CoolSculpting? Do you do it only after the CoolSculpting treatment, or do you bring them back for additional Z-Wave treatments?
Okay, that's where you guys can shine. So what I like to do is they do CoolSculpting. I tell them, okay, you're going to buy CoolSculpting. We're going to sell it at whatever price you're selling it at, $700, $800 a cycle, whatever your price in your region is. That's fine. So you sell it, and then you say, look, if you buy this many cycles, I'm going to give you 2 Z-Wave treatments. If you buy this many, I'm going to give you 4. Now, if you buy this many, I'll give you 5, and then $300 for each additional one. But what I do is I do it with my CoolSculpting immediately. So within seconds of that handpiece coming off, with this, as soon as you take that cycle off and they're done and you're ready to do that manual massage, you're going to do about 30 seconds to a minute of manual massage. You're still got to do a little bit. Then throw that Z-Wave on, have that machine on, ready to go. Seconds count there. You really want to hit them right away. Then you're going to bring them back a couple times that week, 2-3 times that week. And then I like to bring them back in a week or two and keep doing it. It's just going to give you so much better results. So again, you can decide how many you want to do, what you're comfortable with. But this is something that you don't have to do. You can have your estheticians, your nurses, MAs, anybody can do this. This is radial pulse technology. So depending on what state you're in, almost anybody can do this.
Okay, I think we've blazed through our half-hour webinar here, but we do have several more questions piling up here. So would you be willing to stay an extra few minutes to get to these?
Absolutely. I'm happy to.
Okay, you mentioned anyone can do this, so that ties right in with the next question. How do technicians feel about the CoolSculpting Z-Wave experience?
So here's what I want you guys to do. So treat your staff. So when you're doing CoolSculpting, treat them. Let them get it. Let them experience it. Do the manual massage once. Then on another cycle, do the Z-Wave. Let them see it. What's going to happen then is they're going to sell the heck out of it for you because they're going to tell your patients. They talk to the patients more than you. So they're going to tell them the difference. They're going to make these people want to come in to see you for that Z-Wave. So we train our technicians to do it. It's very simple and easy. They can do it. My nurses do it. I live in Ohio. They're pretty specific about things, but even in Ohio, I can have an esthetician do the Z-Wave, and that's no problem. So after my nurses do the CoolSculpting, the estheticians can do the Z-Wave, not a problem. It's very easy to train. It's simple. It takes 10 minutes to teach how to do it.
Okay. Has adding Z-Wave proven to be a competitive advantage in attracting new patients?
Absolutely. I mean, it's my, I'm giving away a lot of my secrets here, guys, but, I want to help you. So it 100% is. It's a huge, huge advantage because it's going to give you a one-up over your competitors when it comes to CoolSculpting. It's going to make them want to buy from you versus someone down the road that doesn't have the Z-Wave.
Okay. How do patients react to Z-Wave treatments, and what have they said to you about it?
They love it. They actually beg to come in. I'm going to be honest. So my mom had breast cancer. She had a lot of swelling lymph nodes. We run this right over those lymph nodes. She was moving her arm. People come in with plantar fasciitis. They can't, they can't stand on their feet. It hurts. You do this, they're going to think you're awesome. We've done it on staff members before they go and run marathons. They had sciatic nerve pain. Run it up and down the leg, right over that sciatic nerve. They can move around again. It is phenomenal. So that's how it gave us a competitive advantage.
Okay. Let's take two more questions here, just in the interest of time. Okay, I'd like to hear more about how you use Z-Wave for numbing and pain desensitization with aesthetic procedures.
Okay, so right before we do any aesthetic procedure, whether that's Ulthera, whether you give them a shot, if you're doing the P shot, the O shot, any of that stuff, what do? We use a little massager or vibrating instrument, and that will go and that desensitizes the pain receptors. That is the whole technology. All the research is there. When you use vibration technology, you're desensitizing those nerves. You're reducing the pain. What we're doing with the Z-Wave is we're just hitting deeper, and we're just making it even better. They're totally into this thing because they love it. It helps so much with the anesthetic effect that if you try it yourself and you do one patient without this and then the same patient later with it, they're going to hit you and be like, why didn't you do that first? So we like to use this anytime we're doing an aesthetic procedure in replacement of our massagers or our little vibrating devices over whatever area you're treating. Do it for about a minute, then do the procedure. You'll see the difference yourself.
Okay. I might have lied here because another great question has just come in, but here's the one that I had for you. Are there any other less commonly known applications for Z-Wave that you can use? And one more after this.
Yeah, so erectile dysfunction, Peyronie's disease, tattoo removal, plantar fasciitis, of course, cellulite, body contouring, radio frequency, tattoo removal to break up the ink. Again, also afterwards with the pain. I like it during massages too. Like a lot of our massage patients are having neck pain, cervical neuropathy. We'll run this over that and they can go through. Sometimes I sleep the wrong way and I'll just go in and hit the Z-Wave over my neck for about 5 minutes before I start my work, and I feel so much better. So you can actually use this for so many things. It's insane.
Okay, last question. Is Z-Wave treatment painful?
No, it's actually pretty pleasant. It's not painful at all. You rub a little bit of gel on the skin, and then you just use this. It doesn't get messy. It's not like not like doing our laser procedures where we use gel. It's just a thin little layer. Then you wipe it off. It is not painful at all. You can also do it over the clothes, but I like it to be a skin, device to skin contact. I think it works a little bit better, but it's not painful whatsoever.
Okay, one of the attendees has made me chuckle here. They say, come on, one more question. Will you allow it?
Sure, go ahead.
Okay.
Go ahead. We're having a good time. Let's do it.
Absolutely. Can you use the Z-Wave treatment after completing an Ultra Shape and Vela Shape?
100%. Vela Shape and Ultra Shape. Again, that's in the same realm of body contouring. I want you to use it after that. I mean, Vela Shape, Ultra Shape, that's right in the same realm of the other things we talked about, including rate of frequency there, right? So you can totally use a Vela Shape and Ultra Shape. I have a Thermi also. We can use it after that.
Okay, thank you so much for that discussion, Dr. Nanda. So much great information.
Absolutely. Thank you for having me.
And if anyone would like more information about Z-Wave and Z-Wave Pro, please visit Zimmer MedizinSystems website at www.zimmerusa.com. You may also visit shop.zimmerusa.com to purchase accessories and marketing materials for your Z-Wave device. And this concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review any of this information at your convenience. Good night.